Good afternoon, everyone. I'm Dr. Sharon Levine, the section head for geriatrics at MGH, and I want to welcome all of you, people who've been with us and people who are new, to our MGH Senior Health COVID-19 virtual town hall. Today's topic is living in the time of COVID, creative coping today, and how we are preparing for the future. I also want to take this time to introduce our two new geriatricians in senior health, Dr. Deborah Lee and Dr. Warren Backman. And I'd also like to introduce our two new geriatrics fellows in training. That's Dr. Lee and Dr. Backman, and our two new geriatrics fellows, Dr. Minnie Dagar and Dr. Melissa D'Souza. And of course, I want to welcome our speakers today, who will be introduced further in a moment, Dr. Greg Myers, Dr. Olivia Okereke, and Dr. Sindura Puluru. And now I'm going to pass off the baton to Susan Edgman-Levitan. Welcome all and enjoy.
Thank you, Dr. Levine. It's my pleasure to also add my welcome to everyone today. I'm the director of the Stokel Center for Primary Care Innovation at Mass General, and I'm going to be your moderator.
I haven't put on lipstick since.
Oops.
I think we need to mute some people. Started. Everyone on the call except for the speaker will be muted because that helps us eliminate background noise. You can view the speaker on your full screen, or you can go to the gallery view in the upper right corner. The gallery view looks kind of like a checkerboard, and that way you can see everyone that's on the call. If your picture becomes jumpy or out of sync during the town hall, click the Stop Video button down in the lower left-hand corner, because that will speed up your internet connection and make the ability to hear and see everything much better. We will have a time later in the call for questions, so please use the chat function, which is, you'll see chat at the bottom of the screen in the middle. You click on that and send us your questions. A couple of cautions though. Please do not share personal medical questions on the chat, because anything you write in the chat can be seen by everyone, and we can also see everyone on the gallery view. So we don't want anyone to show us your rash or anything you might be concerned about, okay? If you do have a medical question, please reach out to your doctor directly. So we also got a lot of excellent questions that we're going to try to address later in the call. And if we don't have time to answer them all, please let your doctor know or someone from the senior health practice. So with that, I'm going to introduce all of our speakers at the beginning, and they will then hand off the presentation to the person following them. So our first speaker is Dr. Greg Meyer, who is the Chief Clinical Officer for Mass General Brigham, and he's a professor of medicine at Mass General and at Harvard Medical School. Our next speaker is Dr. Olivia Okereke, and she is an associate professor at Harvard Medical School and the director of geriatric psychiatry at Mass General. And then our final speaker is Ms. Sindura Puluru, who is a nurse practitioner at Mass General Senior Health. So with that, I'm going to turn this over to Dr. Meyer.
Good afternoon, and thank you, Susan, for the introduction. And thanks to all of you for taking time to keep both yourselves and our community safe. This is an investment of your time, and it is really, really appreciated by us. I'm going to begin just by giving you a brief overview of where things stand within the Mass General Brigham system. And then I want to answer just a few questions. You know, what can you do to be safe? What we are doing to create a safe environment within Mass General, and then finally, you know, what we're doing to prepare for potential recurrence. So let me begin just by a brief overview of where we're at today. As of this morning, there are 33 patients who are hospitalized right now across the Mass General Brigham system. Of those, 10 are on ventilators. Now, to put this in perspective, if I was talking to you now 2 months ago, we would be talking about a 0 at the end of those numbers. And so a really dramatic decline. We also are delighted. It makes my day when I open up the dashboard every morning and I see that we had no patient fatalities in the last 24 hours from COVID-19. With all of that said, the reality of it is that we remain extraordinarily vigilant. As you probably have heard, that there is a small uptick in the Commonwealth of cases in 20 to 29-year-olds, and you know that from what you've read and you've heard, they generally do well. And that's not what I'm worried about. It's not that I don't care about my own kids who fall in that age range, but what I care about more than them is I care about the fact that they come in contact with people like you and people like me. And so it's really important for us not just to watch what's going on in the hospital, but to watch what's going on more broadly in the Commonwealth. To just dive into some practical information, what can you do to be safe? I'm pretty well rehearsed in this because my wife and I actually drove out to visit my 92-year-old father who lives alone on our family farm on the border of New York State and Vermont. And we had a socially distanced visit. And he asked that question, what can I do to be safe? Well, the top 3 things are things that you know about. And frankly, it's stuff that you heard on the news, and there are no surprises here. And that's the good news. This is understandable, right? Clean your hands. Wash your hands frequently. Use Perel or another antiseptic as often as you can. Wear a mask. It works. And finally, keep that physical distance. Now, if we all did those 3 things, we would be in much better shape. And in fact, if just 50% of the population did all of those things religiously, we would slow down the spread of the virus considerably. So although they're very straightforward and simple, they're really powerful. But I'm going to ask more of you today. So that's the first 3, but I have 3 more. The 4th one is get a flu vaccine when it's available. It's going to be very tough for us to handle the rise in flu cases at the same time as another surge in COVID-19. The reality is we don't have as much as we would like to prevent COVID-19, but the flu vaccine is a powerful deterrent to infection, and we need you to get your vaccinations. The next is support our economy. There's a real pressure out there among many who recognize that being shut down economically is an extraordinary hardship, and it's causing morbidity or mortality of its own. Whatever you can do to support local businesses, do it in a safe, socially distant way, but whatever you can do will make a difference because that will help relieve the economic pressure that's going to force us to reopen prematurely. And finally, keep informed. The only thing that is not going to change about COVID-19 is that things are changing. And the only way that you're going to keep up with things is remain informed, and participating in a forum like this is absolutely essential. And so have those few trusted sources, and I would suggest that these town halls should be one of them. Keep your discipline, keep plugged in, and when you need to access that virtual care. The second question I was asked was, what are we doing to create a safe environment for all of you? And here's an important lesson that I really want you to listen to, is that much has been said about those who are working on the front lines in healthcare, that they are heroes. And I have spent a fair amount of the last few months in the front line of healthcare. In addition to my usual roles of primary care general internist and chief clinical officer, I was helping run Newton Wellesley Hospital for several months. And I was on the wards every single day. And what I was doing was important. What I was doing was hard. But what I was doing was not heroic. And I am not disparaging my colleagues at all. We absolutely need to be appreciative of our healthcare workers and all of our other essential workers, from the folks who take away the trash to those who make sure that we have food on the table. But the reality of it is for healthcare workers, we were not heroic. We were doing our job, and it should be appreciated. But a hero is somebody who runs into a burning building. A hero is somebody who takes heroic action under live fire. That's not the way it felt. PPE works. We protected our healthcare workers. We have the data to show it. And the reason why I feel so strongly about sharing this with you is not in any way to take away from the appreciation of healthcare workers. In fact, my appreciation is as deep as all of yours or more so. But it is for you to recognize that accessing healthcare is safe. We have the equipment, we have the PPE there to protect you, we have the procedures there to protect you, the cleaning. We've changed the way that we let you in and out the door. We're keeping you in a safe place before you see the physician or the nurse practitioner or other provider, and we're trying to do our best to keep you socially distant. I would remind all of you that have taken flights in the last 10 years or so, that oftentimes the best of pilots, when I'm walking off the plane, they get on the intercom, and what they say is the safest part of your journey has just been completed. Be careful on your drive home. That is absolutely true. You are much safer in the air than you are driving your car back home from the airport. Well, the same is true today. The safest part of your day is going to be accessing healthcare when you really need it. If it can be done virtually, terrific. But if you need to be seen face to face, what you can be sure of is that we have taken all the steps we need to ensure your safety. And in fact, the safest part of your day is going to go to see the doctor or the nurse. Be careful when you stop at the grocery store on the way home. So that's kind of the important message that I want to get to there about our preparedness. The final thing that I was asked to talk about is what we are doing at Mass General and across the Mass General Brigham system to try to ensure that we are ready should COVID-19 start to surge again or recur in this community. And I can tell you, we are working diligently on that every single day. We are making sure that we have staffing that is ready. And so we have some challenges there that we are meeting. We're in very good shape on PPE, but we continue to monitor it carefully, and we stockpile the equipment so that we have all the supplies that we're going to need. It will be a different situation than we faced just a few months ago. We're working constantly on improving our ability to test. Getting testing supplies remains a constant challenge and one that we continue to work on. And we are getting better, but we still have a ways to go. And finally, making sure that we have access to critical pharmaceuticals, things like dexamethasone and remdesivir, drugs that have been shown to at least make a difference in the first case in mortality from COVID-19, and in the second case in decreasing hospital stays from COVID-19. So we are taking all of those steps along with very, very close monitoring. So my plea to you is to do those 6 things: wash your hands, wear a mask, keep socially distanced, do those other 3 for me: get your vaccinations, keep yourself informed, support the local economy. You do your part. We are doing ours, and we're doing the very best we can at it. And we'll be there for you when you need us. With that, I'm going to turn it over to Dr. Okereke. Thank you very much.
Thank you. And thanks to all of you for coming today. I'm going to start sharing my screen so you can see the slides as I get started here. And here we go. So my focus is on coping in the time of COVID-19. I know many of you are curious about this. We had a question, for example, on how to cope with extended periods of isolation. So that's a lot of what I'll be touching on, but some other things as well. So older adults, as we know, have been the most vulnerable age group when it comes to the effects of COVID-19 in terms of higher hospitalization, complications, morbidity, and mortality. But they're also a vulnerable group when it comes to some of the stresses of this pandemic, including those of being socially isolated from social distancing practices. Furthermore, it's important to remember that about 25% of older adults report having 1 or more mental health conditions in their lifetime. 10% of older adults are experiencing depression at any given time, and about 35% at least have some form of age-related cognitive impairment. So that means that people are dealing with this pandemic and coping with the consequence of that in the context of an underlying history of mental health comorbidity. A lot of people are dealing with it in that context. So that means we need to consider both general approaches for coping as well as more specific ones for people at higher risk. And similarly, I'll talk about this in terms of both individual and community-based resilience. So first, I'd like to share with you this general list of pointers for coping during COVID-19. Now, this comes from the National Institutes of Health, who held a seminar on some of this recently. And they developed this mnemonic for mastering or overcoming stress. And so first of all, healthy, balanced eating is critical. So this means higher amounts of fruits and vegetables, nuts, legumes, also increased consumption of fish and lean poultry as opposed to red meats, and healthy oils like olive oil, supplementing the diet, as well as staying very well hydrated. So avoiding social isolation is a critical one. This can be done in a number of ways, but scheduling regular phone calls or video chats or contacts is important. Try to make it scheduled, find a time that people agree on. So it's not random. You're not wondering when's the next time you're going to be in touch with people. Spending time in this way can be nurturing even if it's not in person. Stay informed, but try not to get overwhelmed by the news about COVID or other current events. So this means checking that 1 or 2 reliable news sources, but just once a day is fine. It doesn't need to be repeatedly throughout the day so that you can stay informed. And engaging and enlisting in whatever help you need. For example, asking for help from others if you need it to set up video connections or get certain delivery services of food or meals or pharmaceuticals and so forth. Many items here on this mnemonic pertain to self-care. So for example, the importance of taking time to breathe, to meditate, getting outdoors at a safe social distance and while wearing a mask, of course, remembering to wash your hands. And of course, the act of simple gratitude is something that actually can be quite uplifting. So just enjoying a soothing cup of coffee, looking at beautiful flowers, these kinds of things that you can feel grateful for, in addition to the people that you have in your life, can be very uplifting. And finally, it's important to keep routines. So getting up and going to bed at the same time every day actually helps to provide an anchor to your day and a structure to your day. And it also turns out to be one of the foundations of getting good sleep. So keeping routines very important. So what about older adults with underlying vulnerabilities? So there's an increased risk among susceptible people to the stresses of social distancing, isolation, and just coping overall with realistic concerns about COVID and current events. So one of the ways we can mitigate mental illness exacerbation is staying connected to healthcare providers. And that means using virtual services, which have hugely ramped up, certainly in our system and in other systems around the country. And that might mean meeting more frequently with a psychiatrist or a therapist or mental health provider, having proactive steps such as more frequent check-ins, using patient gateway or some other type of modality, and using therapy boosters for those people who need a little bit of a change in their treatment to address or head off a crisis at the pass. And also the work that healthcare providers and care providers more broadly do to help ensure essential needs such as food, medicine, supporting social services and stable housing is critical for people with underlying depression, anxiety, and existing illnesses, because it's often those factors that can be the precipitants of loss of coping if they're not adequately addressed. So prioritizing mental health for ourselves and encouraging others in our lives to prioritize their health and keeping up with their mental health visits is very important. Another factor to keep in mind is that with increasing age, cognitive impairment, including dementia disorders, become more common. And that means it's harder to cope with many of the challenges of COVID-19 because there's decreased cognitive resources and an increased demand in tasks. People sometimes talk about just getting up in the morning and feeling kind of overwhelmed by how much there is to do. So how can we help with that? Well, certainly we can make sure that people get care partners or family or others enlisted to help with technology, software, video conferencing technologies, whatever it is that people need to stay connected. As I said, also making sure those essential needs of food and medicine delivery are set up. So for example, just helping people get connected to one of these many online services that provide this, making sure that it gets scheduled regularly. Multitasking gets harder as we get older, and it's especially harder in the face of cognitive impairment. So that means if people are helping to sort of shore that up, it decompresses the task load. And doing that is actually something that helps people feel better emotionally and cope better. But we also have to keep in mind that there are challenges for care partners as well. And this is something I've seen quite a lot of because many care partners are also older adults. So for example, they may be helping someone in the same household while trying to mitigate risks of COVID-19 exposure, where they're also within an age group of increased vulnerability. So we have to be mindful of that. Social distancing may not be realistic in the way that we think about it for everyone. And wearing a mask and providing people with information on how to be care partners safely is important. They also need encouragement to use the same resilience, enhancement, and wellness strategies I mentioned earlier in that mnemonic to help avoid getting overwhelmed and burnt out, and to maximize their own feelings of effectiveness and in their role. I'd also like to talk about another area of increased vulnerability for older adults, and that's been the disproportionate impact of the COVID-19 pandemic among the most vulnerable in this country, and sort of the mental health or spiritual ramifications of that. It's really exposed the fractures and weaknesses in many ways of our healthcare systems, particularly as it pertains to older adults who are Black or from minority backgrounds. There is an excess burden among minorities of essential workers who are compelled to work, often in less ideal situations, potentially dangerous situations, then return home to multi-generational households where they may also be the family care partners of older adults, and transmission is more likely to occur in those settings, most likely to occur in those settings. So there are these intersections of race, ethnicity, economics, employment, and geographic factors that are involved in these disproportionate impacts. And recent data has actually shown that there is increased reporting of anxiety levels in minority communities related to this. And this is occurring in the context of structural racism affecting Black and minority older adults. So we need to attend to the fact that this is part of this context on a community level that increases mental health sources of stress. There are other broader consequences to think about with regard to COVID-19. So there's grief, loss, a sense of fear, health-related fear or anxiety, sometimes even feelings of being demoralized or feeling despairing about so many people in the community, in the country, especially older people, being ill, dying, or being socially isolated. So many people can sometimes struggle with feeling abandoned or uncared for when they see, in the face of them trying to keep themselves safe, younger people crowding restaurants, flouting social distancing. So we need to acknowledge that these kinds of failures of communal responsibility are their own kind of emotional hazard for older adults, for all of us really, but for older adults especially who are at particular risk, placed at risk by those failures. And I think it's really important to acknowledge and take stock of that. And there are many ways in which I'll just say that the mental health and spiritual ramifications of some of the national moral failures on an unprecedented scale are the kinds of things that are likely to go beyond what we can see or know right now, but they will be part of the mental health impacts of COVID-19. So I think that what we need to attend to is the fact that there are community as well as individual level factors to address, to enhance our resilience in coping. So those activities that foster safe distance or virtual interactions are particularly critical. This needs to be ramped up, for example, in nursing or care facilities where social distancing practices have particularly been a hardship for older adults. And coming up with more creative, safe ways to allow interactions at safe distance is going to be very important. Use of virtual faith services is another great tool for community resilience. At least 70% or more of faith providers have moved into some kind of virtual space. Lots of people are making use of this and increasingly finding it to be helpful. It's a difference, it's a transition, but it can be helpful. And then just the act of sharing information and resources with other people to discuss the seriousness of the situation and to not feel so alone in this is something that I believe also can help at the community level. And the nice optimistic sign is that we do find that community resilience building factors can help. So among the Black and Latinx population, there was some recent data that just came out last week actually that showed that optimism levels remain high. And people with higher optimism levels are able to maintain or sort of buffer against poor mental health, even in the face of the stresses of COVID-19. So this really tells us this comprehensive approach addressing community and individual resilience for mental well-being is likely to be best. And I'll leave you with this final slide, which is an adaptation of a framework that comes from the National Academy of Medicine, formerly the Institute of Medicine. Now, this is a framework for prevention of mental health problems, but this is an adaptation I use to address in the context of COVID-19. So we can think of indicated prevention as addressing early signs and symptoms of mental health relapse or exacerbation in the sizable proportion of people who have underlying depression, anxiety, comorbidity, and this may be increased appointments, changes in treatment, or other actions to intervene to prevent crisis. Then looking at selective prevention is addressing issues for people at higher risk by using more outreach, enlisting care partners, adding resources to shore up essential needs, and so forth. And then finally, universal approaches apply to all of us. So these are those general approaches that I listed in that mnemonic earlier in the presentation on how to overcome stress and build resilience and wellness. So I will stop there. I think we'll have more time for Q&A later on.
Thank you, Dr. Okereke. Good afternoon, everybody. I have some general updates regarding senior health practice and scheduling appointments with our clinic. If you are watching and belong to another primary care practice, please do call your PCP office with any questions. Our clinic is fully open and ready to support all of your medical needs. We're open for in-person visits or for virtual visits. If you have an acute medical concern, or if it's been more than a few months since you have had a routine follow-up visit, we encourage you to please call our office to book an appointment either for an in-person evaluation or for a virtual visit. At this time, per national, state, and hospital guidelines, we are seeing only a few patients per day for in-person visits. And we're strictly following infection prevention protocols to protect you and our staff from exposure to COVID-19. A member of our staff will also call you the day before to review and to ensure that you're not having any acute respiratory symptoms or fever prior to coming into our office. In regards to virtual visits, they can either be conducted by a telephone call or through a video visit. Video visits are preferred over telephone visits as they allow for us to see you and we can perform a modified physical exam. You can complete a virtual visit either using a smartphone, a tablet, desktop, or a laptop. The hospital is using Zoom video technology as the preferred mode for virtual video visits. In order to be able to conduct a Zoom visit, you do need to be active on Patient Gateway, which is an online portal that gives our patients secure access to health information. And you also need to have downloaded the Zoom application. If you do not have Patient Gateway, we do recommend that you sign up for it, and our administrative team can also help you with signing up for it. But if you don't have Patient Gateway, we are still able to conduct video visits through other video applications. Many of you have likely already used Zoom application technology, for example, to join this meeting, or either for another medical appointment or to talk to your family. As you know, sometimes there can be some last-minute glitches or problems that you may encounter that may end up delaying your virtual visit. In general, we have some simple tips that we encourage you to follow to decrease any problems or delays with your Zoom video visits. At least an hour or so before your appointment, we encourage you to restart your computer or laptop and shut down any apps that you are not using. Zoom application can be a bit demanding on your internet connection. And also to make sure that you're using the latest version of Zoom and check that your audio and video settings are enabled. Our team has also implemented protocols to help guide our patients with virtual visits. Our administrative team generally will call and remind you the day before your upcoming virtual visit about your visit, as well as a patient gateway message that will be sent, and they'll encourage you to review the message for any virtual visit tips and troubleshooting tips. We're also working with our medical assistants and creating a protocol to call our patients approximately 30 minutes or so before your scheduled visit to help troubleshoot any last-minute issues. And if needed, our patient gateway support team can also be reached at phone number 1-800-745-9683. We encourage you to prepare for your visit by writing down any concerns or questions you plan to address during your visit. Also to have a list of your medications or medication bottles handy to review with your provider. And if you monitor your vital signs at home, such as your blood pressure or heart rate, we encourage you to have that information ready and to provide that to your provider as well. In closing, I just want to mention again that our office is open and we're ready to assist with any of your medical needs, and we look forward to hearing from you. Thank you.
Thank you. And thanks to all of our wonderful presenters. We have some great questions. And Dr. Meyer, because you brought up airplanes, I'm going to give you the first one. We got a really thoughtful question from someone who is flying to see family in Chicago and Denver. And they shared what they're planning to do, and we'd like your feedback. So they are going to wear a hospital-grade disposable mask. Should they try to get a legitimate N95? Should they wear a plastic face shield for any part of the travel, either in the airport during boarding or on the plane? And should they be tested for coronavirus prior to leaving? And then finally, this person is planning to quarantine for 10 days before going and book the flights at hours when airports most likely are less busy and in first class. So is that okay? And would it be better if they were in the first row or on the aisle? So I may need to repeat some of these, but if you would you like to respond to that? Because it's a great question.
So first of all, congratulations to you for being so thoughtful, the questioner, about how to approach this. I think the first thing is to even back up before that and just say, how essential is this travel now? And what I would say in addition, in pre-work is being very mindful of what's going on in the cities that you're visiting. And again, recognize that what's happening today might be different than what's happening in 1, 2, or 3 weeks' time when you might be considering this travel. In terms of what you're doing for personal protection, I think you're heading absolutely in the right direction. Wearing the hospital mask is I think the right thing to do. I don't see a reason why you would need to use an N95 in this particular circumstance. The reality of it is if that gives you an extra sense of safety for yourself, that's fine. You should go ahead and do it. But from a medical standpoint, that's not necessary. The other thing I would say in terms of wearing a face shield, again, in this setting, not necessary. Many folks wear, what are essentially clear spectacles, which actually serve the same purpose. What's much more important than that is just keeping your hands away from your face and good hand hygiene. And so one of the things that you can do now is you can carry one of those very small bottles of hand sanitizer. You are allowed to bring them on a plane with you now. And I would recommend that you do that. And you can use the hand sanitizer frequently during the flight. In terms of the logistics of the flight, again, you're thinking of the right things, trying to keep yourself spaced. And, what you may want to do is look at that seating chart, even in first class, the evening before you're going to go on your flight, and see if you can move around to create that extra distance. And then, in terms of the times to travel, the only thing I would caution you again is I would look very carefully at the planes. If you go to select a seat, even if you don't want to select a seat, you go to select a seat, you can see how many seats are full on the plane. And although I think your general logic is reasonable to say that if I fly on off hours, maybe I'm a little less likely to come in contact with somebody, the reality of it is that other people may be thinking the same way. And you just need to maybe look at that seating chart and see how full that flight is. But the airlines also will, they do publish data. It's not so easy to come by, and sometimes you have to make a phone call, but they tell you how full the flights are on that particular route. And that may be worth investigating to try to find out what your best bet is. Finally, in terms of, testing and quarantining, the single most important thing I would suggest that you do is go ahead and get tested sometimes right before you travel. The bottom line of this is about you, but it's also about the people that you visit and keeping them safe. And so I do think that the combination of trying to keep yourself isolated, absolutely, and frankly, what most people would say is 10 days good, 14 days better. I know that's a big commitment, but something to think about. But getting tested shortly beforehand. So good for you. You're thinking of all the right things. A little bit more homework that you can do, I think, to prepare yourself well. And ask yourself maybe 1, 2, or maybe a third time, do I really need to go now? Can I put this off? Is a virtual gathering going to serve my purpose? And maybe put off that trip for another few months till things calm down a little bit.
Thank you very much. One question that came in that I'm just going to address very quickly was a question about whether there are similar town halls available for parents or children for our pediatric patients. I know our Department of Pediatrics has been thinking about this. I'm not sure where they stand, but I think we could get you that information and share it after today's town hall. So my next question I'm going to give to Dr. Matt Russell. And this question is a question about what kinds of recommendations do you have to be safe if you're bicycling, and also if someone is returning for dental care. You're on mute.
I'm muted, exactly. There we go. Now am I unmuted?
Yes.
Great. So the first thing is just to echo Dr. Meyer's statements. This is actually, every healthcare setting has to go through a whole host of protocols to ensure that the patients and staff are safe. So, check with your dentist. I had my dental cleaning about a month ago, and I had to, just like everywhere else, wait in my car until I was called to come in with a mask, was given hand sanitizer, brought to the room, no stopping at the front desk. So check with your dental clinic, because something as routine as general dental care, or even something as emergent as I have a really high fever and I'm really sick and I might need to go to an emergency room, but I'm afraid I'm going to get COVID, so I don't want to go to the emergency room, and now I'm sick at home. We've seen that in some instances. And so what we really recommend is just to echo, our healthcare delivery has caught up with infection control, and we would encourage people to stay connected with their healthcare providers. And as always, check if there's any doubt, check with your provider's office and say, what are you doing to keep people safe?
Any recommendation about bicycling?
So then the second recommendation about bicycling. So when we're doing exercises with exertion, we're inhaling and exhaling a lot more deeply. So it is something where we are potentially able to transmit or are able to pick up things. So if you're in a population dense area, say if you're on the Esplanade and you're going for a bike ride, that would be definitely a moment to wear a mask. If you're out in the woods on a trail and there's no one around, the risk of transmission either way is very low. But I think that what I've seen many people do is decide, well, it's too hot out, so I'm not going to wear a mask. And I see this on the Esplanade when I go running. That's not the idea here. The idea here is if it's too hot to go running and you can't wear a mask, you probably should go for a swim.
Okay, thank you. We have another question, and I'm going to turn this one back to Dr. Meyer. And it's a question from someone who has an appointment scheduled with their internist in October and is thinking about whether this should be an in-person visit or a virtual appointment. But I also think this is an opportunity to sort of underscore all the different things that we're doing in our ambulatory settings to make sure that our staff and our patients are safe.
Sure. So I think, first of all, in terms of, is a virtual visit appropriate? The only answer I can give you is it depends. And frankly, it depends on what the nature of that visit is going to be. If it's following up on, some blood work and a blood pressure check and some routine care, then handling that virtually may be incredibly sensible. If, on the other hand, this is a check on something where it's really essential that the doctor, lay hands on you. That shouldn't be put off. And again, we are doing all we can to make that safe. I think that Dr. Russell covered most of the points that I would make about what we're doing to keep you safe. That includes before the visit to reach out to you, to check you for symptoms. So if you do need to come in and you're sick, we have ways to handle that. But we would handle that differently than somebody who's otherwise feeling well. So we'll reach out to you ahead of time. We will, before we let you through the door, we will call you in to try to keep you out of the waiting room. The whole notion of waiting rooms, frankly, is one that all of us are happy to see go. And frankly, that may be one of the good things that comes out of the tragedy of COVID is that waiting rooms become a bit of a thing in the past. But you'll get called in at the appropriate time. That notion of not stopping, that when you walk through the door, you go right to an exam room as you're made sure that you have the right mask, you one more time screened for symptoms, you get the hand sanitizer, and you be prepared for the fact that your provider is going to be wearing some personal protective equipment as well, and they may seem a little bit more compulsive than usual about their hand hygiene than usual when they're with you. And I would just ask you to forgive them and that they're doing the right thing to keep you safe. And then afterwards, what I would always encourage you to do is that notion earlier that was talking about, make sure you're on Patient Gateway, and that way you can get the follow-up information from your visit via Patient Gateway when you're back home and you're safe. And as I said before, be careful in the grocery store on the way home.
Great, thank you. I'm going to ask Dr. Okereke. We had a question early on about how do you deal with prolonged confinement? And I think you addressed many of the strategies that people could use, but I just wanted to see if you have anything else to say about that.
Sure. Well, I think that in general, it's important just to sort of take an inventory, or what are the circumstances leading to the extended period of confinement? Is this someone, for example, who might normally be homebound for most of the time, and now this is compounded by the COVID-19 situation? Or is this someone for whom, this is a marked change? Being at home, socially distanced, is a big difference from their usual way of being from day to day. I think that's important to consider in terms of the extent to which the mismatch here causes distress to people, as that could be a factor. But there's really no reason to be physically confined indoors as long as a person is physically able to be mobile out of doors. As Dr. Myers and others have alluded to, there are a lot of other considerations you can have and can apply when you're out of doors. And so I talked about, for example, going for a walk. A socially distanced walk of, say, 30 minutes duration at a reasonable pace, no more than 3 times a week, is excellent physical activity. That can be done at a social distance, wearing a mask, and that will serve the joint purpose of getting out of the confining space of home, breaking up that monotony, and also achieving the purpose of getting physical activity, which is extremely important as well. So, there are a lot of different reasons why it might be harder or easier for some people to get outside of the home. Some people just have less green space around them, and it's they're physically in an environment, in an urban environment where there may be less green space. So there are a lot of other considerations here that may differ from person to person. But speaking more broadly, I think that there are some opportunities for this. And I can say that there are people who have told me that they've benefited from, if they're in a situation where they don't have as much access to green space, literally going for a socially distanced walk with another member of their household, just in the street level area that's around their house, is enough to feel like they're getting out of the monotonous environment of being inside the house. And I think that seems to be what this questionnaire is getting at, is breaking up the monotony and how burdensome it is to be in that monotonous environment.
Yeah, thank you very much. We have another question. I have to say you all would win at Jeopardy given the quality of your questions. But this question I'm going to direct to Dr. Russell, but anyone else can jump in. And the question, I'm going to read it because I think it's important to hear the whole story. So the question is, my 15-year-old grandson, whose home is abroad, lived with me this past academic year to attend high school in Cambridge as a freshman. He went back home in May, and the plan is for him to come back here for his sophomore year. He would live with me. I'm 75 but active and in good health, excellent health. I live alone with my dog. My house is ample. My grandson has full run of the third floor and spends most of his time there. I stay on the first and second floors. Any thoughts about the school is not decided yet, and I think we're all sort of waiting for this, about how they will reopen, but is it safe to welcome him back?
So this is a great question that gets to a lot of risks of never being zero, but harms of social isolation being quite tangible. I would never tell someone who has a family member who could keep them company, potentially through a lockdown in a winter situation, to abandon that for the hypothetical risk of exposure. At the same time, the same standards would apply. If this is a child who's going out back and forth, socially distancing at home, wearing a mask in the shared space, that's probably prudent. And it's for each household to really figure out what level of risk is most reasonable for them to assume. I think we want to keep our older folks safe. If we're washing hands, if we're able to, when we get together, be in a more open area, that's better. And the usual things that we do in a grocery store, we would want to do at home for someone who's going in and out. A more common scenario is someone living with, and I think Dr. Okereke spoke about this, many of us live with our parents or older generations as caregivers in healthcare. And we also realize that when we're going from a hospital setting to home where we may have been exposed, we run the risk of bringing something. So we're taking all these precautions as well. So I think as long as everyone is doing the usual stuff and recognizing that staying totally isolated is also not healthy. And it can be very, very, I think, what was the word you used? Demoralized? Was that the word you used, Dr. Okereke? Or despair.
Yes.
These feelings that we get from just being alone, it's harmful. And this is one of the things that we do in our field in geriatrics, is we want people to stay connected in as many ways as possible. And if there's this pesky virus around, let's figure out a way to work around it so that we can achieve that.
One other thing I just want to mention that we heard about on one of our previous town halls from some of the leaders in the aging community in Boston is there is a program that pairs people who are living alone with other people where they can have regular phone calls and connections. And they actually pair people based on mutual interest. And so that's another program that we're hoping to share information about with everyone, because you can just call a number and get connected to someone And there are, these kinds of programs do exist in other parts of the world. And the thing I love about them is that the people that often call to get connected end up volunteering to call other people. So it really does build strong, robust communities of people that previously were alone and pretty isolated. So, so we'll share information about that as well. We do have another question about dental care, and this is, Matt, I'm going to go back to you. You're the dental expert. And the question is whether it's safe or not to take a parent with underlying comorbidities for routine dental care. I think you touched on a lot of this before.
You did. I think it's also important to recognize that sometimes some of our patients with cognitive impairment have a hard time wearing masks and staying compliant with social distancing. So it's sort of the short answer is it depends, but the more complete answer would be try and do problem solving with the dentist to say, hey, you know, if this is something where mom is having trouble wearing a mask, or she's just confused, she would be confused, but she understands that she has to go to the dentist, what can we do to keep safe? And that gives staff the chance to prepare their situation, keep themselves safe, and also keep your parents safe. So I always encourage people, no one should worry alone, no one should suffer alone. This is where you call the healthcare providers who want to see you and want to do what we've been trained to do, and just say, what are we going to do? Keep me safe.
Thank you. Thank you. So we do have a comment that I think is worth sharing with everyone. We have someone who says, I'm blessed to be among your patients. And while news media naturally focuses on seniors who are having a hard time, how about we who are simply living on, taking similar precautions to when we were young, before antibiotics and vaccinations against dangerous childhood diseases existed? And I think that's a very important thing to remember, because actually some of us can also remember that, you know, when the polio vaccine came out and whatever. So thank you for sharing that positive perspective with us. So I'm going to make a couple of announcements, and then I'd like to turn this back over to Dr. Levine to just close out this town hall. But we do really need your ideas about future topics that you're interested in hearing about, and pretty much anything is game. We have a really fun time putting these together, and we'd like to address anything that you want more information about or that would be fun for you to hear about or participate in. Our next town hall is scheduled for August 20th, and we're working on some exciting speakers. One I think that we have confirmed is Dr. Suzanne Coven, who is our writer in residence at Mass General Hospital. She's also a general internist, and she's going to be sharing some ideas about books that are really fun and interesting and help us maintain our resilience that we might want to read now that the weather maybe starts getting a little cooler in the fall. The other thing is, if you do have ideas about topics, please send those to Monique Chateauneuf, whose information is in the chat box, because we're really looking for that information. So again, I want to thank all of our speakers today, and I'm going to turn this over to Dr. Levine. And welcome all of our new fellows to Senior Health.
Thank all of you for coming today. And I want to say that I really agree. For those of you who want to come in, come in. It's really wonderful to see you. And we have such a wonderful time when we get to see you. We can't hug and kiss, but we can wave across the room with our masks. But we also love seeing you at home. I made house calls for 30 years, and I sort of feel like I'm making a house call when I talk to you virtually. And I know a lot about you when I do that. So it's really important. And then I guess the final thing that I would say is that, you know, this has been a really scary time for everybody, and we have learned a lot. We know so much more than we knew in February and March. And no matter what happens when there's another wave, which there likely will be, It will never, ever again be the first time. We've already passed the first time. And once you've been through the first time, we know what to expect. We know how to take care of you. We know how to take care of ourselves. And we can keep practicing medicine, and you can keep taking care of yourselves. Don't stay away, because we know how this works. And we will have a vaccine at some point. I agree with Dr. Meyer. Get the flu vaccine. Don't miss that this year. For right now, our vaccine is washing your hands for 20 seconds, using this as you can, and wearing a mask. That's the equivalent of our vaccine for right now, along with social distancing. So, and go out and take walks, because I agree with Dr. Okereke. Every time you take a walk, it's good for your brain, it's good for your heart, it's good for your bones, it's good for your mood, and it's just good in every way, including your spirits. And you can do it with or without a mask. It doesn't have to be far. And do it with somebody if you need to, far away. Just get out there, and we have to find the way to live in uncertainty. And we're all doing our best to do that, including with our families and our friends. It's the new normal, but it's never going to be the first time again.
Yeah. Thank you very, very much. I just want to remind everybody, if you look at the chat, we've got a lot of the helpful information there about the Patient Gateway support number and Monique's information to send ideas for our next town halls. And thank you so much for joining us today, and we look forward to seeing you in August. Have a wonderful afternoon. Bye-bye.